Chairman today for holding this hearing, and welcome all of the congressmen to my district. This is the heart of my congressional district. It's the economic hub. Thousands of my constituents come to work every day in this district, and as you know, 5 million international travelers come through this airport every year. So in response to that, I'd like to submit for the record a letter to the Honorable Jay Johnson that I made this morning asking for Dallas-Fort Worth International Airport to be included or added to the list of the 5 airports that are going to have the increased screening.
Without objection, so ordered.
Thank you. There are approximately 13,500 people from the affected areas that have travel visas that are active at this point. What federal agency is responsible for knowing who those 13,500 people are and the status of their travel?
Well, the Department of State issues that visa, so they would be responsible for who has them and under what conditions. Customs and Border Protection would encounter that individual when they arrive to the United States. And part of what we determine in that inspection process is, does that person intend to comply with the terms of that visa? And then are there any grounds for inadmissibility, such as a communicable illness, that would prevent them from coming in?
So if we indeed are at a critical point in containing this disease, don't you think it's important, or wouldn't you think it's important, that there be some identifiable base of people that that have come through Customs and Border Control, that are in the United States or have traveled in the United States, that have presented their passport, have been questioned, have been screened, and so that we have some idea of what the number is? I mean, how many people could this possibly have affected?
Well, we would know how many people came into the United States from those affected regions over the course of, any period of time. Where they are in the United States, or who they've had contact with, or what has transpired since then is a much more complex issue.
So the DFW airport is not usually the primary point of entry for these countries, but as most people across the country know, if you go anywhere in the United States, you're probably going to have to go through DFW airport. And I think it is very critical at this point that we understand that people are coming into JFK and they're coming into Newark and these other 5 entry points and staying 1 or 2 or 3 weeks or 4 weeks, and then they are coming through DFW airport and they're going all over the country. So I think this is a key place where we need to have an active program of screening going on. Do we have a CDC facility that is close? Are we one of the 20 areas where the CDC has a center?
Mr. Waggers, no, we do not have a staffed facility at DFW. We may have a physical space, but it is not currently staffed.
Mr. Chairman, I would like to request that the CDC strongly consider DFW Airport as well as George Bush International in Texas in fully staffing those. Our governor has just recently asked questions about whether our CDC facilities, where they were located and how well they're staffed.
Without objection, and just for the record, I submitted